show in the past who supported the idea of quarantines, and we've heard that pop up again, and I'm sure we will in the future.
No, I don't support the idea of quarantine. I don't believe it is warranted in the case of AIDS, because AIDS is not being spread by the same means that other diseases, which we have used quarantine to help control in the past, like tuberculosis or cholera or other type things. And in fact, if we begin to push quarantine right now, it may actually cause people to begin to be more panicked and more hysterical and withdraw even more, and it may actually present graver problems to trying to check.
Is there any areas of employment, and then we'll go on to some other questions, but is there any areas that AIDS-infected people work in that they should be prohibited from doing?
Well, I think we need to have some serious question in regards to whether certain healthcare workers who are infected with this virus should be employed in situations where they come into daily contact with patients, especially in hospitals, because virtually every patient has health problems in a hospital. That's where they're there. And you certainly wouldn't want a surgeon who's infected with this virus to slip while he's operating on you and cut his own hand. You know, and so there are, within the healthcare field, I think there are serious questions that need to be answered regarding the risk of transmission from a healthcare worker to a patient. Now, there haven't been documented cases of that occurring yet, but I think that's something we need to keep a close eye on.
Okay, let's go on to some of the impacts. You mentioned there are financial impacts.
Yes,
Tell us
AIDS
what.
will dramatically affect the economy of the United States over the next decade, by the turn of the century. Right now, AIDS costs about $1 billion in terms of direct health care costs, and about $7 billion in terms of lost productivity each year. That number, by one study that was performed recently using a computer model, those figures are expected to rise so that by 1996, the annual direct cost of AIDS in terms of health care could exceed $50 billion, and the cumulative economic cost of AIDS, including lost productivity, could reach $1.3 trillion by the year 1996. By 2006, those numbers go up to close to $120 billion in direct health care costs, and may well top $8 trillion by the year 2006 in terms of its total economic impact. When you consider that we have a $2 trillion national debt right now, and you start pouring those dramatic cost of AIDS on top of that national debt, you can't help but to believe that this is going to have an incredibly negative effect upon our economy.
Now again, of a lot of those cases out in the future, you think a great number of them, what percentage do you think have AIDS today? And what percentage are still yet to be infected?
Over the next decade, if the average latency period of this disease is 12 years, then the people who are infected today will be developing AIDS sometime over the next 12 or 15 years. Now,
if nobody else was infected from today on, what kind of numbers do you think we're looking at? Let's say everybody today, from today on,
we stopped the infection, no more infection,
and only those that currently carry it. How many people are infected?
Yeah, that's a difficult question to answer because we don't know how many people are infected right now. The CDC has estimated that it's anywhere from 276,000 to 1,750,000. It's a pretty broad range of estimates. They're kind of dragging their feet on doing a study to really answer that question. They say it can't be done until mid-1990.
Is this because it's difficult to test for some of the early phases?
It's not difficult to test, it's that they don't think people will cooperate. Researchers with the Walter Reed Army Institute of Research in Washington, D.C. Think that the CDC is not being right in that. They say it can be done in six months to a year. And they're the ones with the most experience in terms of mass testing, because they test the entire military on a regular basis. They think it can be done in 6 months to a year. But in answer to your question, it's generally conceded that there are about 1.5 million Americans infected right now. Could be more, but it's probably not much less. So if no more were infected, and this is an invariably fatal disease, as most experts believe, then we would see by the year 2000, say, 1.5 million deaths at least as a result of AIDS.
That's obviously substantial. It's very serious, obviously. The social issues, let's talk about that, social impacts.
Well, it's dealing as it does with sexual behavior. AIDS impacts on just about every social issue you can think of. It impacts on education. Right now, AIDS is being used to increase government involvement in education, both public and private, in terms of AIDS education, which really is little more than sex education with information about this disease thrown in.
I'd like to ask you a little more before you move on to something else in that regard. There was some controversy in the Fremont area last year in regard to the curriculum in some of these AIDS education programs. Some of it was found to have been suggesting materials that came out of very explicit, virtually X-rated organizations, and many parents were concerned that there was pushing the AIDS education as it was being pushed at the time in local schools was actually promoting some very promiscuous type literature to the children. What has been your experience? I'm only speaking of our local community here, and that fortunately a lot of that was changed. What have you found around the country?
Well, I'm not familiar with yours here. I do think that around the country, because we've got to remember this is being done in public schools, and within public schools you run into a problem when you start trying to teach morals, because we've got this mythical idea that we shouldn't teach morals to our children if the government's involved in it, the whole idea of separation of church and state and on and on and on. So you have a problem. They say that AIDS education needs to be value neutral in the public schools. Therefore, you can't tell a child under this type of an idea that homosexuality is wrong and you should not perform it. You will tell them that it may not be the best for you, but you shouldn't say that it's not wrong as a general rule. And so there's almost no way to get around it in terms of public school education, AIDS education. There's almost no way to get around it being value neutral, which really means it's reinforcing relativism and humanism, a relativistic ethics about sexuality.
A lack of ethics, essentially.
A lack of ethics, yes,
right.
Essentially.
What's the solution to that in the public schools?
Well, I think we need to change our basic understanding of public education, our understanding of education as a whole. I'm a great advocate of homeschooling, but that's not why you have me here today. However, I do believe that within the public schools we can and must begin to emphasize the importance of the family, emphasize the importance of marriage, and that marriage and the family are essential to a strong and healthy society. We should emphasize that homosexuality is harmful, as we do emphasize that drug abuse is harmful. Homosexual behavior is physically harmful. You can get AIDS and other diseases. It's psychologically, morally, spiritually harmful. And that should be said in an educational program about AIDS. And I think we do need to emphasize the traditional Judeo-Christian values that have made our nation great. One of the underlying reasons why AIDS has gotten out of hand is because we've stopped to be a moral people as a nation. If this disease had been around 200 years ago, in the days of our founding fathers, it would never have reached the epidemic proportions that it's reached today, because they were basically, as a general rule, a moral people. We have stopped being moral people as a nation. We've become immoral, and the disease has gotten out of control in our midst because of the rampant immorality in our society. So I think that needs to be emphasized, that we have to have a traditional moral value framework for our educational approaches to AIDS.
Do you think that's too much common sense for our public education system to absorb?
I wonder sometimes. I don't know. Seems to be fairly obvious that it should be.
Let me ask, you've talked about national security being affected.
Yes.
How?
Well, in a number of areas. A lot of people somehow seem to forget that the plagues and diseases have played an important role throughout history in bringing down nations, empires, civilizations. AIDS could well be one of the most challenging foreign policy and national security issues confronting our nation by the turn of the century. We could have a military manpower shortage as AIDS begins to cut in to that age group where we would need to draw men to fight in a war if we got into a war. It's going to undermine third world countries. It's going to the international communist conspiracy is going to be ready to take advantage of the social and political turmoil